If the Academy could say to the next President of the United States, whether it be McCain or Obama, this is the single thing we would like to happen when it comes to healthcare reform,
Yes.
what would it be?
Yes. It would be to build a new transformed healthcare system on primary care as its foundation, its solid foundation, with the patient-centered medical home being its basic building block. In that model, there would be access for patients to go and be seen for both preventive, acute, and chronic care. And in that model, we can keep both the nation's workforce healthier, we can keep people healthier, we can decrease morbidity, we can decrease mortality, and at the same time save cost.
What you're suggesting, though, is big and bold.
Yes.
And given the past 20 years of largely failed efforts, some
Yes.
successes, but largely failed efforts at healthcare reform or change, do you think big and bold is the way to go in 2009, or is it small incremental steps to get where you want to go?
Yes. Big and bold, I would say, is the best approach right now. And the reason I would is that we have a bit of a burning platform here. We're on the precipice of a healthcare meltdown. In 2017, Medicare is predicted to be insolvent. Healthcare in America is bankrupting both many businesses as well as many patients' families. And so we've got to get fairly quickly to a transformed healthcare system now that will lower costs and increase healthcare outcomes. Right now, that's not happening in America. And if you take a look at the projected trends of healthcare costs, they're only going up. And so we're sitting right on top right now, Jackie, of a ticking time bomb. We must grab hold of this problem now.
And what is your expectation, not your hope, but your realistic expectation that something will happen in Congress, in the White House,
Yes.
in the next several years?
Yes. I remain both persistently positive and aggressively optimistic that this will happen. And primarily the reason I do so is I just know the financial imperative the nation is facing. Winston Churchill once said that America will always do the right thing after it tries every other option. I think what America is recognizing now, what the rest of the world has already recognized, is that a return to a healthcare system that has primary care as its basic foundation, and this concept of the patient-centered medical home as its basic building block, will achieve exactly what America is looking for.
And if that does happen, how does the income of the family practitioner change?
Yes, it should increase. And the reason it should is that we've never, as family doctors, we've cared for many, many patients for many, many years. And all of the non-face-to-face service that we provide, which we believe is important for patient care, has never in any way been reimbursed. It's never been paid. What's happening now is that the margins of family medicine practices have become so thin, they have no margin to be able to give that back. So for instance, putting in an electronic medical record or personal health records for patients, there's no margin to do that. We can't pass that cost back to the payer, back to the patient. And so unless there are incentives, care management fee built into that, we can't get to that, to leveraging that new technology in the information age for patient care. So it's a system in which there must be enhanced payment. There should be for the family doctor. The other big piece that I'd like to just mention in that regard is that what we're seeing with medical students is that they're choosing to go into more lucrative specialty areas because the payment's better. And so right now in America, 80% of the graduating students are going into specialties as opposed to general care, such as family medicine, general internal medicine, or pediatrics. And what that's doing is it's robbing the nation of the workforce that must happen to be able to provide basic primary care to the nation. So what will happen from the process is that not only will it return care back to the patient-centered medical home, back to primary care, but with the payment enhancement, it will also make sure that family physicians can do that. And I think many, many medical students, seeing that it is a positive career, this will be something that I can repay my medical loans by going into this specialty, will drive them back in force into family medicine.
And what does your concept do to the overall medical bill of the nation?
Yes, it lowers it. The reason it lowers it is that by investing with wellness, investing with acute timely care, investing in quality ongoing chronic medical care, with having patients be accessible to that kind of care, it'll save them going to the emergency room where care is about 10 times more expensive, or into the hospital that might have been prevented in the first place. And so by the savings in the system from the back end of care and refocusing that then on more of a wellness, health, chronic disease management approach, there will be savings in that system. And that's what the medical lesson was from North Carolina, was by doing that with a high-risk population with Medicaid patients, it saved that state considerable money.
Okay, thank you so much, Dr.
Thank you
Ted
too,
Epperly.
Jackie.
Appreciate it.
You betcha.
The Kaiser Family Foundation presents health08.org, election news, analysis, and events.